Welcome to the Think Small podcast, hypergrowth for small businesses. So, what's slowing you down?
Well, hello, everybody. Welcome to the Think Small podcast, where we sit down with the leaders who are doing the real work of building businesses, teams, and building the kind of communities where companies can actually grow. I'm your host, Denise Steinbring, and today I'm talking to someone who is going to reframe the way that you think about healthcare costs. Because if you run a business and you offer health benefits, this conversation is going to cost you money if you miss it. Charles Carter is the CEO of UnitedHealthcare, Central and South Texas, which means he leads the commercial health plan operations for one of the largest and most diverse markets in the United States, covering Houston, San Antonio, Austin, and the whole surrounding region. He's a fourth-generation Texas, a native Houstonian, and one of the most connected healthcare and business leaders in the market. He has spent 30 years in health insurance without ever leaving Texas, without ever chasing a title somewhere else, and without ever losing sight of what he actually cares about, helping employers understand that they have more control over their healthcare costs than they think. So Charles, welcome to Think Small. I'm really glad that you're here.
Denise, thank you for the invitation, and I appreciate the opportunity to visit with you and your audience.
Great. Maybe you can fill in the blanks. I talked a little bit about your background. Anything that I'm missing?
No, I think you covered it pretty well. I did actually leave Texas for a small period of time in the early 90s with a former employer, but once I had children, I was quickly urged to come back to Texas or my parents were going to kidnap my kids. So I got back as quick as I could.
Good decision. Well, hey, you've spent 30 years inside of one industry, starting as a senior account executive and rising to CEO of one of the largest commercial health plans in the country. Most people in your position either move companies or to move up or they plateau, but you didn't do either of those things. So what is the one thing you understood about building a career inside of a large organization that most people get wrong?
Well, maybe back up just a little bit. I didn't enter the industry as a senior account executive.
That's my
I actually was working my way through school and started out by stocking shelves in a pharmacy that was owned by a managed care organization that I worked for at the time, and eventually became a pharmacy technician. And as I was working my way through school, I realized there was a career that really aligned with my values in the healthcare system. And that's kind of what led me into the sales part of the business. And when I joined UnitedHealthcare 23 years ago, I joined as a senior account executive.
I see. Yeah. Well, that's something we have in common. I was a pharmacy technician too and learned how to read doctors' handwriting.
I've been told I should be a doctor based on my handwriting, but probably the most valuable role that I've ever held in all the roles that I've had is actually answering the phones in customer service, because it gave me the perspective of exactly what it is that our customers need and what their challenges are. And that continues to be my North Star, even in my current role as CEO, is the 6 months that I spent in customer service. It really became that foundational value for me in how I manage myself and how I lead our teams.
Yeah, that's great. So was there anything that, about that arc of your career that taught you, why building a career inside of a large organization was the right way to go? Did you ever wonder what you were missing by not leaving that company?
Sure. Everybody does, right? We always second guess decisions. That's part of how we get better. But it's about connecting yourself to the mission of the organization. And if you can't align with that mission, then that's probably the cue to change. But within UnitedHealthcare, I found an organization that the mission to quite literally improve the healthcare system for everyone, as broad as that is, was really a mission that I aligned with. And once you do that, an organization with a breadth of resources and scope of products that UnitedHealthcare has really gives you the chance to do anything that you set your mind to within the organization.
That's great. And when you made that jump from VP to CEO, what was that like? What did you have to build or sacrifice or change that you weren't maybe expecting?
It was a very humbling experience.
Mm.
As you think about being a high performance, individual contributor, even a high performance leader of a sales organization, making the change to a CEO really puts you in a position of having to understand the entire enterprise and how all the different pieces connect together, and how important building consensus is and working across what we like to call a matrix environment.
Mm-hmm.
You have a lot of people that you depend on for your business and your results that you do not necessarily always have direct authority over. So that ability to understand and align incentives and build consensus was probably the biggest challenge in making that change.
Interesting. Yeah. I've always wondered, when you step into a new role like that, do you have a lot of people that reach out to you because they want to be known, they want to be seen, they want to have their voice heard? Or do you find that people kind of back off because they're not sure who you are, what you're going to do, what your beliefs are, etc.?
Probably more the former. They're, especially if you've been on LinkedIn, you know how that works. And so everybody wants to make that connection. And, there's a limited amount of time in the day. And one of my, best confidants told me when I took the role, just learn to be ruthless with your calendar. Learn how to say no, because there's going to be no shortage of people trying to get in front of you. And, you still try to make time to mentor and connect and, be present, but there is a limited amount of time in the day sometimes.
Yeah, probably good advice. Well, you wrote in the Houston Business Journal that C-suite leaders can play a much more active role in building the future of healthcare in Houston, not just as buyers of healthcare benefits, but as architects of what a healthy workforce actually looks like. So most of our small and mid-market company CEOs who are listening treat their health benefits sometimes as an HR problem to solve once a year, and then they don't think about it. So what are the best companies doing differently, and what is the single biggest mistake you see small business owners make with their health benefits strategy that is costing them money and talent that maybe they don't recognize that they're losing?
Most small business owners are very entrepreneurial, and they think, I think, as you pointed out, that human capital, as the industry jargon is kind of messy. They don't want to deal with it. But I think that's the single biggest mistake, is not being personally involved in what is often their second largest business expense behind payroll. They have a tendency to treat those benefits as kind of a once in every 12-month crisis. That's a fire to put out, a decision to make, and then they move on down the road. They don't see it as they should, which is a big part of talent strategy, culture, and financial planning.
Mm-hmm. And do you see, companies that get this right, are they working with their HR team kind of throughout the year, really keeping their finger on the pulse of employee retention, sickness, absences, healthcare claims, all of that kind of thing, really managing it as part of the P&L?
I say the most successful ones are at least putting it as part of their quarterly review, looking at the information that's available to understand what's driving their cost, what their health burden of their population is, and quite frankly, weaving that in with some of their worksite safety programs and the other things that they do to ensure that they have a healthy, productive workforce.
Yeah, that's great advice. Well, as you well know, right, the health insurance industry right now is going through one of the most difficult periods of public trust in its history. Sorry to go here, but I think this will be really interesting for our listening audience. Employers are frustrated sometimes. Employees are confused, and everyone has a story about a claim that was denied or a prior authorization that took weeks. You are the person responsible for UnitedHealthcare's relationship with Central and South Texas. So you're the face of this industry in your market, for better or worse. How do you lead your team and build client relationships when the industry you represent is under a level of scrutiny that you didn't create and can't fully control?
Well, I'll try my best to get through this without being emotional, but when Brian Thompson was murdered, it really devastated all of us. As a leader, it was really a wake-up call. for me to realize that I probably haven't done as good a job as I should have in preparing our teams to help our customers and constituents to really understand the value that UnitedHealthcare brings to the healthcare system. And there was so much misinformation out there. And at times, it felt like we were being defensive. So I did spend a lot of time with our team, working through arming them with the facts, helping them, reinforce the value that we bring to the table. If you think about the healthcare system, of all the constituents or all the players in the system, the managed care organizations are the only one whose real mission is to control healthcare cost. The other components of the system are constantly trying to accelerate cost. So that puts us in a position of really trying to be that voice of the customer and the consumer that gets the right care at the right time at the right place. And sometimes that does create friction, and we're not without mistakes. And so a big part of this was really showing up, being there in person, listening to our customers' concerns, acknowledging that there's still a lot of progress to be made in the healthcare system, but then being transparent and sharing with them, here's what you may have heard on social media, here's what people are telling you, but these are the facts about your own employees' experience and how we've been working with you to provide a valuable program for your employees, the friction points, and how we've resolved those. And I think having a little bit of humility in that is also a very important thing about how we manage through that.
Yeah. And so when businesses face sort of a crisis like that, a lot of people kind of go into war room mode, right? Like, let's get our leaders around the table. Let's understand what our position is. So part of it is a PR exercise that you have to get the right information out to the market. But you mentioned, getting closer to your customers and really listening to them. Were there any different strategies or approaches that you took? How did you get to all of those customers in your local market to make them know, hey, I'm here. I want to hear from you. I want to set the record straight. And I want to humbly submit that there are things that we can do better. And I know UnitedHealthcare is currently working on some reframing of prior authorizations, and there's activity underway. So maybe you can talk a little bit about that.
Well, first of all, it's really about the team. The team faces out and touches so many more people and customers than I can. But as they ran into more difficult conversations, that's where our entire leadership team was there to support, the individual contributors by accompanying them in a lot of those difficult conversations. And I think that is, what we should have done and what we were expected to do. So I think the team felt very supported, that they knew they had support of their leadership to go out with them and face those difficult questions. And following up, quite frankly, especially with new customers who didn't have the benefit of years and years of experience with us. Those were the ones where we made it a point to, 6, 8, 9 months later to follow up with them and help them understand, hey, thank you for your confidence in us. When we had this conversation, these were the data points we discussed that we would come out and have a conversation about, and then present them with the data that validated the experience that their employees were having. But you're right, our mission is really, we've got to simplify the healthcare system to the extent that there are services that are not overutilized or abused or used inappropriately. Those are the things that we're eliminating prior authorizations. Probably saw recently a 30% reduction in prior authorizations. So it's about eliminating waste and abuse in the system, which there are studies that still show there's 25 to 30% fraud, waste, and abuse in the healthcare system. Mm-hmm. And part of our job and what our customers expect us to do is to eliminate that as a cost driver while creating as little friction as possible.
Yeah. I mean, that was just an awful time in our nation's history when Brian was killed. And are you doing any sort of pulse of the market? Is the perception of the United States turning more favorably towards healthcare, or are you still kind of in the middle of it?
The work's not done. We're in the middle of it. there are people who have experience, with a brand like UnitedHealthcare. When I'm out in the community, I hear from many, many people who are our customers. And, more often than not, it's, we love you guys. You're doing a great job. You've taken care of my family. But occasionally you run into someone who's had a bad experience, and that's when it's up to us to engage, address those issues, and quite frankly, resolve, whatever that issue might be. But we've got a long way to go. As you can tell right now, it's very much a political football for both sides of the aisle. And so we've got to continue to be present and help everyone understand the value that we bring through value-based care, quality care, driving as affordable, unit cost as we can with our provider partners. So that's it's not going to end anytime soon. It's definitely ongoing.
Yeah. All right. So let's pivot more towards the operating side of the business. So, as consumers, they feel like healthcare and benefits costs continue to rise. So what do you think that employers, especially small to medium-sized businesses, can take more ownership of and control over this part of their operating expenses rather than feeling at the mercy of the system?
Well, I think I mentioned it earlier, engage and play an active role. There are many levers that a lot of employers may not realize that they have in order to exercise some influence and control over their cost. Things like high value network products, innovative pharmacy programs, virtual care, member support and education. But I think probably most of all, programs and products that show price transparency. One of the things that I think has been most exciting in the last few years is really this ability to measure not only the cost of care, but on the outcome side, matching those two things together to create a picture of value. And, one of the products that we have, which is called Surest, makes a shopping experience for the member very much Amazon-like, where as they look at a map around them and they're searching for a service, it will provide them with price tags that vary based on quality and cost. And that's ultimately what we're trying to do with the system, is understand that there's massive price variations for similar quality services within any ecosystem of healthcare. And one of the things that can help bring that under control is by having the consumer be empowered to make those kind of decisions and those kind of shopping experiences, just like they do for anything else they shop for online.
Interesting. So that's a great program. Where is the innovation happening right now in UnitedHealthcare, whether it's through technology or better customer experiences or things like that? Do you have other examples that maybe people don't know about?
Well, I think AI is a huge topic for everyone right now. We've got over 1,000 cases of use cases of AI in the enterprise right now. A heavy focus of that is really on how to not replace people, but help our people be more effective. There's a lot of concern about the use of AI to deny care, for example. Well, for us, AI is about how do we get to yes quicker, and that eliminates a lot of the workload for some of our clinicians, so that the cases they are reviewing are the ones that need that kind of human intervention. That's just one example, but we also recently launched Avery, which is an AI assistant in our mobile application, and it's very good at natural language, how to help people navigate. So I'd say AI is kind of the current frontier about how the healthcare system is going to get better, eliminate waste, and provide a better customer experience.
Yeah. Do you get a front row seat sometimes to AI applications that physicians are using, right, to detect cancer earlier or things of that nature? I would imagine as the nation's largest healthcare provider, you might get to see some of that innovation up front earlier than most.
I do at times. Being based in Houston with the medical center, I've had an opportunity to meet with some of the hospital CEOs and hear, some of the things that they're working on. Won't betray their trust and, get into specifics, but it is truly amazing what technology can bring. And in many instances, for example, cancer care, I was visiting with a hospital CEO recently, and some of the most expensive therapies out there are around cancer, and they're working on developing not only more effective cancer treatment, but some that are going to be much, much less expensive.
That's all amazing. It's a new frontier, I think, for all of us in a lot of ways. So what does a truly well-designed benefits program look like to you? One that doesn't only manage costs for a small business employer, but also empowers employees to make informed, value-driven healthcare decisions. I've heard from a lot of friends who say, well, I get choice in which physician I can get to, but I have no idea how to choose. They all look the same to me. So what does that look like for you?
Well, there's a spectrum, right? There's not one size fits all. So there are going to be people who demand the ultimate flexibility and choice. And there are those who want a more curated experience that actively guides and directs them. Our mission is to have a spectrum of products that employers can choose from that fit their culture, fit their workforce, and fits their needs. But I would say that the thing that's common across all of them is, quite frankly, I think UnitedHealthcare does it best, is the ability to identify the highest value providers in the healthcare system and provide either information, to your point, how to choose, a particular physician. We pioneered a program years ago we called Premium Designation, which essentially takes their own teaching and accreditation institution benchmarks and measures physicians in their quality. And so we're seeking to be that trusted source of advice for our members on how to choose not the cheapest, but to choose the best, most effective. And what we know is when people choose higher quality, you're going to have better outcomes, and it's going to be less expensive when you do it right the first time.
Yeah.
So there are a lot of products that incorporate those types of strategies. So I would be looking for things that have great member tools on how to educate them on which providers they should be seeing. And you can do that through education. You can do it through copay structure, plan design. But again, it takes an active, engaged employer to make those kind of choices with an intent that they have a long-term strategy of improving the health of their workforce.
Yeah. Well, I love the human touch that you have there in your community. And another fascinating thing about your background is that you are a board member of the CFO Council of Houston. So how does that perspective shape the way that you advise and guide small and mid-sized businesses, particularly when it comes to making smarter, more strategic decisions around financial control and benefit costs?
I became involved in the CFO Council of Houston out of a desire to listen and to learn. One of the most valuable things that I can have as a business leader is an unfiltered perspective of other business leaders. So an opportunity to work with the CFO Council of Houston was a fantastic opportunity to sit and listen to the challenges that small and mid-sized businesses encounter every day. And then understanding how what we do at UnitedHealthcare can help them achieve their business mission. So, I spend most of my time listening to their needs and challenges, but encouraging them to be a strategic business partner with their CEO or business owner. CFOs have a unique lens and can really help drive business growth and profitability if they can help make the connection between the financials and a high-performing, high-value workforce through improved human capital employee benefits.
Okay, great. Well, you've offered us a lot of pearls of wisdom during the last 30 minutes here, but maybe one last piece of wisdom. For small and mid-sized business leaders who might feel that escalating costs, benefit costs are unavoidable, what actions or mindset shifts would you encourage them to adapt to regain control and build a more sustainable benefit strategy? You touched on this a little bit, but anything else?
Get get immersed in the data. There is a lot of information out there regarding their health of their employee population with their health insurance carrier. Understand what's driving that, and then make sure that your broker or consultant is really aligned not only with your desire to control cost or achieve a certain price point, but also aligned with the values of your organization, the culture that you're trying to create. I think that's really important for small business owners to understand that, again, it's not a crisis at a point in time every 12 months. It's an integral part of the value of their business, because, every business runs on their employees, and having a great, attractive benefits program that helps them attract and retain talent is a key part of how they're going to grow their business.
Yeah, sound advice. Thank you for that. Well, Charles, this has been exactly the kind of conversation that I hoped it would be. Honest, practical, and useful for anyone running a business right now. For our listeners who want to learn more about the employer benefit strategies you talked about, or who want to connect with you directly, where should they go?
Well, I'd be happy to give you my email address, which is charles_carter@uhc.com. And of course, like every large employer, have a fantastic website with a lot of information out there at uhc.com as well.
That's great. And for our listeners, if you're a smaller mid-sized business anywhere in the country and you just heard Charles talk about health benefits and you realize you haven't thought about this strategically, maybe even in years, that feeling is the signal. This is a line item you can actually influence. So Charles, I really appreciate your time, your honesty, and your 30 years of showing up for your community there in Houston. It's been a real pleasure. Thank you so much for your time.
Denise, it was a pleasure visiting with you today. Thank you.
Thank you.
Welcome to the Think Small podcast, hypergrowth for small businesses. So, what's slowing you down?